Hello everyone. So the current topic is brachial plexus. The learning objective for brachial plexus are the following. At the end of the session you should be able to describe the brachial plexus with all its branches. You should be able to draw diagram of brachial plexus and what can be the lesion associated with brachial plexus. Before that, you should know about a diagram of a typical spinal nerve. You can see here when we see the section of a spinal cord and how a spinal nerve arises, you can see there is dorsal root with the dorsal root ganglion, there is ventral root, and they are going to form the trunk of the spinal nerve, and which is attached here with the sympathetic ganglion. From the trunk there is dorsal ramus and there is ventral ramus. So this ventral ramus is again running in the intercostal space and it is giving different branches. So this is diagram of a typical spinal nerve. Now, what is brachial plexus? So brachial plexus is network of nerves. It lies in neck and also in axilla, and it is formed by ventral rami of C5 to T1 roots. Okay, so from here C5, C6, C7, C8 and T1, and of these spinal nerves it is the ventral rami which is going to form the brachial plexus. Brachial plexus can be prefix type or post-fix type. Now in post-fix type there is, along with C5 to T1 there is T2 also, and in prefix type along with C5 to T1 there is C4 also, and these nerves innervate the upper limb. Now what are the components of the brachial plexus? So you can see here from C5 to T1 these are the roots, and from the roots here we are specifically mentioning that ventral rami of C5, C6, C7, C8 and T1. Now from these roots there is formation of trunk. There is upper trunk, there is middle trunk and there is lower trunk or inferior trunk. From the trunk there is division, so there is anterior division and there is posterior division, and based on these division, so you can see here from the upper trunk the anterior division of upper trunk, and here we can see the middle trunk that is going to form the cord, that is lateral cord, and the anterior division of inferior trunk is continuing as here medial cord, and posterior division of all the three trunk going to continue as posterior cord. So we got roots. From roots trunks are formed, trunks further divided into anterior and posterior division, and from there the cords are formed. So cords are lateral, posterior and medial, and their name is because of their position or their relation to the second part of axillary artery. So here if we see roots, they are situated behind scalenus anterior and they emerge between the scalenus anterior and scalenus medius muscle. The trunks, as I told you already, trunks are three trunks: upper trunk, middle trunk and lower trunk. They cross the lower part of the posterior triangle of neck, so they both are present above the clavicle, so they form the supraclavicular part of the brachial plexus. Now the division, they are situated behind the clavicle, and the cords, as I mentioned already, cords are lateral, posterior and medial. They are situated below the clavicle, so the cords and the branches are forming the infraclavicular part, roots and trunk forming the supraclavicular part of brachial plexus. The roots, they are arising behind the scalenus anterior, so they are situated between the scalenus anterior and scalenus medius. So here is the formation of brachial plexus. First there are roots C5, C6, C7, C8 and T1 ventral rami, and if C4 is involved then it is prefix type of brachial plexus, and if T2 is involved then it is postfix type. From the ventral rami of these roots there is formation of the trunk. Upper trunk is formed by ventral rami of C5 and C6, the middle trunk is by ventral rami of C7, and lower trunk is by ventral rami of C8 and T1. Upper trunk anterior division and middle trunk anterior division forms the lateral cord. The lower trunk anterior division continue as medial cord, and posterior division of upper, middle and lower trunk continue as posterior cord. So lateral, medial and posterior cord, again I am repeating, they are in relation to the second part of axillary artery. So if we see the branches, so there are three branches which direct arises from the roots. There are two branches which arise from the trunk, and that too only from the upper trunk. Division does not give any branches, but from the cords, lateral cord give 3 branches, medial cord give 5 branches and posterior cord give 5 branches. So you can see here from the root, C5 root, there is dorsal scapular nerve, and then C5, C6 and C7 give long thoracic nerve. These two nerves are coming from the here, these nerves are coming from the roots. Also they give contribution to the phrenic nerve. From the trunk, only from upper trunk 2 branches arise. One is suprascapular nerve and another one is subscapular nerve. The nerve to subclavius. And from the cords, if we see the lateral cord, there are 5 branches. From posterior cord, from lateral cord there are 3 branches. From medial cord there are 5 branches, and posterior cord there are 5 branches. So you can see here this is the posterior cord, this is the lateral cord, and this is the medial cord. So from medial cord, medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and medial root of median nerve. Apart from that, medial here, this is continuing as the ulnar nerve. And from the here, the lateral cord, there is lateral pectoral nerve, there is continuing as musculocutaneous nerve, and also lateral root of median nerve. Posterior cord give 5 branches: upper subscapular, lower subscapular, thoracodorsal, axillary, and then it is continuing as radial nerve. So from the roots there is dorsal scapular nerve that is coming from C5 root. There is a long thoracic nerve that is coming from C5, C6 and C7, and also C5 root is contributing for phrenic nerve, because phrenic nerve have the root value of C3, C4 and C5. From the trunk, upper trunk, there is suprascapular nerve, and from upper trunk there is nerve to subclavius. No branches from the division, as I have mentioned earlier. From the cord, from lateral cord, there are 3 branches. There is lateral pectoral nerve, and it is continuing as musculocutaneous nerve, and lateral root of median nerve. So you can use a mnemonic LML. Medial cord give 5 branches: medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, and also ulnar nerve. So the mnemonic can be M4U. From the posterior cord, there are 5 branches. There is upper subscapular, there is lower subscapular, there is thoracodorsal, there is axillary, and the root is the cord is posterior cord is continuing as radial nerve, and we can remember by ultra. So the main nerves, musculocutaneous nerve is muscle of anterior compartment of arm, that is it is nerve supply for the flexors of the arm. Median nerve supply most flexor muscles of the forearm and intrinsic muscles of the hand. Ulnar nerve supply flexor carpi ulnaris, part of flexor digitorum profundus in forearm and also intrinsic muscle of hand. Axillary nerve supply deltoid muscle and teres minor. Radial nerve innervates all the extensor muscles of arm and forearm. Then dorsal scapular nerve, it arises from C5 root and it supply levator scapulae muscle here. It supply rhomboids major and it supply rhomboids minor. So these are the muscles of the back. Then nerve to subclavius, it arises near the junction of C5 and C6 ventral rami. That point is known as Erb's point. You can see here it is meeting point of 6 nerves. So Erb's point has 6 nerves, ventral rami of C5, ventral rami of C6, suprascapular nerve, nerve to subclavius, and anterior and posterior division of upper trunk. It is connected to phrenic nerve if it contains fiber of accessory phrenic nerve, and this nerve to subclavius supply the subclavius muscle of the pectoral region. Then there is long thoracic nerve or the nerve to serratus anterior. It arises from the C5, C6 and C7 roots, and the nerve supply is in such a way that C5 supply the first 2 digitation here, C6 supply next 2 digitation, and C7 supply the last 4 digitation of serratus anterior muscle. Then there is suprascapular nerve which also arises from the Erb's point here. It is derived from C5 and C6. At the Erb point it supplies the muscles related to scapula, that is supraspinatus, infraspinatus, and also it gives articular rami to shoulder and acromioclavicular joint. So shoulder joint and acromioclavicular joint are getting nerve supply from suprascapular nerve which arises from Erb's point. Upper subscapular nerve, it is smaller than the lower subscapular nerve. It is arising from the posterior cord. It enters subscapularis muscle and many times it is double. It supplies the subscapularis muscle. Lower subscapular, it is passing deep to the subscapular muscle and it supplies lower part of the subscapularis muscle and teres major. Remember, teres major is supplied by lower subscapular nerve, which is the branch from the posterior cord, and we have already seen that the upper subscapular is supplying the subscapularis muscle upper part. Then there is thoracodorsal nerve. It arises between the upper and lower subscapular nerves. It arises from the posterior cord. It accompanies the subscapular artery along the posterior axillary wall and it supplies the latissimus dorsi. So this is also known as a nerve to latissimus dorsi or thoracodorsal nerve. It accompanies the thoracodorsal artery. So here you can see it is arising here and it is supplying, accompanying the thoracodorsal artery. Applied anatomy. So the lesion in brachial plexus can be due to damage to the whole plexus, can be due to lesion of long thoracic nerve of Bell, or here can be due to lesion of suprascapular nerve, can be due to upper trunk palsy, lower trunk palsy. There can be cord injury where lateral, medial or posterior cord is affected. There can be lesion of axillary nerve, there can be lesion of musculocutaneous nerve. There can be variation and there is because of brachial plexus block. Lesion of the long thoracic nerve causes can be sudden heavy load on the shoulder or carrying heavy load on the shoulder. Symptom and sign, it is described by winging of scapula, prominence of medial border of scapula, loss of pushing and punching action, and also abduction of arm is affected. It is demonstrated by asking the patient to push against resistance with the forearm extended at the elbow and flexed at the to 90 degree at the shoulder. So you can see here, this is the winging of scapula due to paralysis of long thoracic nerve of Bell or nerve to serratus anterior. Here another lesion is upper trunk lesion, which is also known as Erb's palsy. The cause of injury can be forceful separation of head from the shoulder. Okay, so as in case of during birth, and also if there is fall on shoulder. So here C5 and C6 roots are affected. The position of limb here, arm hangs by the side, adducted, because abduction is lost. It is medially rotated, extension at the elbow, and forearm is pronated. So it is also known as policeman tip or waiter tip deformity. So you can see here, these are the features of the policeman tip or waiter's tip deformity in the Erb's palsy. Okay, upper trunk palsy. You can see here, this is another feature, another image showing the upper trunk palsy. Then lower trunk palsy, it is also known as Klumpke paralysis. Site of injury can be either in the lower trunk, that is C8 and T1. Here medial cord involved, that is ulnar nerve, medial cutaneous nerve of arm and forearm. Cause of injury, it can be due to birth injury. It can be because of cervical rib. There can be undue abduction of arm while holding something with hands during a fall from height. So you can see here in this position, there can be lower trunk palsy or Klumpke palsy. Feature here, muscle involved can be ulnar nerve. So because of that, paralysis of intrinsic muscles of hand, ulnar flexor of wrist and fingers. Symptom can be claw hand, medial two fingers are more affected due to unopposed action of long flexor fingers and extensor. Paralysis of all intraossei and medial two lumbricals, and sensory loss on ulnar side of hand and forearm. So you can see here, these are the images showing the claw hand. So this is the summary of the brachial plexus. You have to describe what are the components and what are their location, how the brachial plexus is formed, what are the different branches arising either from the roots or from the trunks or from the cords, and in the last, applied anatomy. So these are the references, and thank you.